Ambulance service, patient breathing.
We're back on the front line, following Scotland's paramedics.
Suspecting an opiate overdose.
For a gentleman said he's got a bomb. There's a RTC bus versus car.
What do you mean by his arm's gone? I need to get these details, OK?
Every day, they save lives.
There's the boot off, all right?
Just had a fit for quite a few minutes.
Hello? Oh my God.
We need to be away from that.
And every day, they face new challenges.
When we go into people's homes, they are at their most vulnerable.
I just don't want to be here.
These things are hard to hear, and we hear them on a daily basis.
Just keep pushing, you're doing really well. We are given the instructions to help save their life. 1, 2, 3, 4.
Working remotely comes with challenges.
So if it's a DV the day,
Met some great patients, get some great stories.
That's okay.
It's a great job.
Slow, deep breaths, OK?
It's opened my eyes to life.
This is Scotland's ambulance service, serving more than 5 million people in every corner of the country. This time, we're with crews in Melrose, Ayr, and Edinburgh.
We've got reports of a brick wall that has fallen on top of 2 people on the building site.
Paramedic Holly and student technician Julie are responding to a serious incident near the city centre.
If there's 2 people, we'll need another crew.
Yeah, that'd be amazing. If there's 2 people potentially trapped, can you get another crew going for this, please, as well?
It says no problem at all. It's 2 male patients, knee injury on one patient, and then the other with a head injury over.
Thank you for that information. I've personally never been to a building site. I feel like when things go wrong in a building site, they go quite wrong.
A brick wall's fallen on them?
Yes.
Oh.
Happened just about 11ish.
Construction workers tend to be quite stoic, and they don't often, they don't just phone ambulances easily. So it sounds silly, but often if you get a job at a construction site, it's usually for something pretty serious.
An update from the call handler to advise that there is 1 patient still going in and out of consciousness over.
Any head injuries with any patients that might be unconscious or have lost consciousness, that's a concern.
There was 2 patients trapped under the wall originally. We then got an update a minute or so later saying that they were both out and that it was still only 2 patients.
Holly and Julie are the first paramedics to arrive on scene.
Right, let's go.
Right.
Hiya.
What's happened?
Oh, hiya.
Just fell on top of them.
Right.
Where are they?
Where are they?
Well, they're up on the shaft here. I'm just making a route for you.
Right,
So
okay.
one young will's got a head injury.
Right, okay, help us on.
His father's complaining of a sore hip. He's up there in a recovery position because he's in shock.
Okay.
They've got another head injury to our male, and the other one's got a sore back.
So there's 4 of them.
4 in total, yeah.
There was double the patients than what we were expecting on the way there.
At that point, you're kind of thinking, I need more resources. So I need fire and I need police to kind of manage the scene, and I need people to make sure it's safe. Because you don't know if it's safe. You don't know if it's going to collapse underneath me. And it's trying to gather the information.
And is anybody lost consciousness or anything?
Maybe lost consciousness, but he's back.
We need to try and be calm on the outside, but panicking underneath. And we get quite good at that, is having this calm demeanour, but it doesn't necessarily mean that that's how we really feel. You give me a hand with some stuff, please? Yeah, got one.
Julie reaches the patients who are up on the scaffolding.
As I got up, I saw that there was an 8-foot wall that had just toppled over, and there was 2 patients lying on top of it. They were both in quite severe pain, and then there was 2 others sat on the sides.
Hi guys, so you've got a head injury? Right, let's have a look. It was quite a chaotic scene, but it's just key at that point that we have to prioritise who is injured the worst. How you feeling, darling?
All right.
Yeah?
To get there and there'll be 4 patients, and actually the 2 patients are still quite severely injured, it is quite a lot, but
It's stressful.
yeah. There was a young boy who was the first one that you saw when you walked in. He had quite a significant knee injury and he had a head injury, and he was in and out of consciousness quite a bit. He was in the middle of the wall when it collapsed, so he kind of got hit with the brunt force of it.
How's your neck feeling?
It feels as what's...
Right, mate.
How's your neck, son?
The patient next to him, he was in a lot of pain. He had his belt on, and it looked like his hammer kind of shattered through into his hip.
And who are the other 2 that were injured?
Boy over there.
The 2 other patients had both kind of been on the outside of the wall that got hit, so like back injuries, rib injuries, and head injuries.
Are you sore anywhere else?
Mind if I lift your top a bit? Have a look.
Inside your mouth. Let's have a look. Your nose bleeding?
Yeah.
Oh, yeah.
Right there.
One of the lads with a head injury, it looks like on the impact his teeth had went through his lip. Yeah, I think your teeth have went through. Sorry, sweetie. There is other crews coming up.
Quite sore.
Okay.
As Holly and Julie begin treatment, more medical backup arrives.
So he's got pain kind of going into his back there. It's on the right side more than anything.
An advanced critical care practitioner, a SORT team, and a 2nd Divisional crew are here to help with what is clearly a complex and dangerous emergency.
Is the pain really bad? Can you ask McCall to bring the morphine up?
40 miles south in the Scottish borders, paramedic Lee and technician Mark are on shift.
Incidentally, when I was doing the checks this morning, I found something out of date.
Did you really?
It was your dad jokes, they're about 10 years out of date.
Got me, got me.
You need to get some new ones.
Well, I've only been in the job a couple of years, to be honest. So Lee's been one of my mentors as I've started my career with the ambulance service. It's good. It's
very
good
much about the dad jokes.
Oh, it very much is. Very bad, the dad jokes.
So the only information we've got for this one is it's an emergency transfer, so a blue light transfer from the A&E at the Borders General up to the A&E at the RAI, the Royal Infirmary. So we know it's a patient with traumatic injuries, but that's as much as we've been told.
A young woman has come to A&E with significant injuries to her abdomen and needs to transfer to the major trauma centre at Edinburgh's Royal Infirmary.
She has been kicked by a horse and received significant care within the A&E department.
Lee's first priority is to get into the hospital and meet the patient.
What we do is want to keep you as still and relaxed as possible, okay? Because of the nature of your injury, we're going to go on the side of caution, and we'll have the lights and sirens on the gate of the road. We just want to be careful, okay, just in case anything changes, okay?
This has been a clinical diagnosis by the doctor in A&E. He's documented this as a grade 5 laceration, which to me is a specifically large laceration across her kidney.
Be just nice and gentle, there'll be a couple of clips.
Which has resulted in her being in a critical condition.
How's your pain feeling at the moment?
Oh, beautiful.
Okay, so what score would you give it out of 10 at the moment? About an 8.
Just as the crew gets ready to embark upon the 30-mile journey, the patient becomes distressed.
So that got worse?
Yeah.
Okay, we'll be back in a second then and we'll just see what we can give you, okay? So 0 being no pain and 10 being the worst pain you've ever had. 10, is it? Okay. Has that just come on suddenly again, has it? Okay.
As soon as we've moved her into the ambulance, she started to deteriorate. We have to work really hard and fast to stabilise her before we move.
Our observations are worrying, to the point that myself and Mark are both concerned at this point.
And where is your pain? Is it right in your abdomen, is it?
Yeah.
Okay.
Oh.
You're doing great. Aye.
I've spoke to the consultant. He thinks just that slight incline in your position is putting too much pressure on your kidney. So I want to just make you as flat as possible. Okay, I'm going to give you some more morphine just now, and then we'll go get going, but your pain should settle before we start going, okay?
You want a blood pressure before that morphine goes in?
Yeah. In our sats, in case we need to give her a bit of oxygen on the route as well.
This is going to get tight in your arm again, okay? Could you just, if you can, relax that left arm out for me a little bit? Helps me get a better reading, okay?
Our blood pressure is very low. It makes pain management very, very difficult. So we're going to give her some sodium chloride to start with to try and build her blood pressure up, and then try and give her some more morphine.
So, see when you were kicked by the horse, did you lose consciousness at all? No? Okay. I'm going to give it a minute and see if it settles, because we've had quite a lot of movement, okay? The way your kidneys are, your blood pressure's going to be a bit up and down, okay? If you start feeling a little bit faint, I want you to tell me. Any pins and needles in your back at the moment?
No.
Any blurred vision just now?
No, I just feel tired.
You just feel tired. So that morphine will start to kick in and that'll start to pass. And then we'll just get you up as quickly as possible.
Things can change very, very quickly in the back when you've got what we refer to as a big, sick, time-critical patient that needs to be at hospital now. So we're going to have to monitor very closely in case things do deteriorate.
Standby request for female emergency transfer from Borders General due to traumatic injuries as patient was kicked by horse at approximately 11:30 this morning. Injury is a grade 5 laceration to right kidney.
My concern is that just that movement from the hospital to the ambulance has intensified that pain, and that may happen again.
Is this the first time you've been injured? Right, okay. Hopefully this doesn't put you off, okay? How's that pain?
It's important for her to feel that she's been looked after and supported in this journey, but also important that she understands as well what's going on. So we'll speak to her and make sure she understands what we're finding, and that we keep her in the loop about her care as well.
I'm hoping it'll not be long, they'll get you a nice cup of tea and your mum and dad will get to see you, okay?
As they arrive at Edinburgh's Royal Infirmary, the morphine begins to wear off.
I've given you the maximum amount of morphine I can give you at the moment. For just 2 seconds. As soon as we get through that door, they can give you something, okay? Right, Abby.
You okay? Poor lassie's not well at all. We've never had to probably work so hard before we've even left the hospital. So, yeah, not good. Not good.
I'm concerned there may be like it's what's called a hematoma, like a swelling around the kidney as well. But she's in the best possible place for definitive care. This is the right place for her.
There are now more than 10 paramedics at the building site in Edinburgh where a wall has collapsed.
If you're feeling dizzy, pal, put your knees up, pal, just for a minute.
They urgently need to get 4 patients down from the scaffolding and into waiting ambulances. But before the men can be moved, their pain must be brought under control.
Can you ask McCall to bring the morphine up? Morphine.
One of the young men is in severe pain.
I'm wondering if this is like maybe a hip fracture of some sort. Morphine is a really, really good drug and it works really well for pain relief. However, even with the max dose, he was still in so much pain. You're all right, you're all right. Keep breathing, keep breathing. Mate, keep going with this, come on. Luckily, critical care were there and they have extra drugs that they can give. So one of them is called Penthrox and they can also administer ketamine. Okay, we're giving you even better stuff. We're getting some ketamine, okay? It's going to help with the pain. Is it still 10 out of 10? So luckily with the use of all of these drugs together, it did seem to help with the pain.
Oh, what the? Good lad.
With the pain the man's experiencing, Holly suspects that he has a pelvic fracture.
Pelvic fractures can be quite dangerous and you can lose a lot of blood from them. They need to be seen in hospital really quickly and get an x-ray done and see what kind of damage there is. And often they'll need to go up for surgery.
We'll start getting moving, I think, with folk.
Each of the 4 workmen will be brought down from the scaffold and onto waiting stretchers.
Ready. They don't work.
No, pal. Just keep going with this, darling. Keep going with that. You can have as much as you want.
The emergency crew work together to carry down the first pair of patients.
David, bring them up a wee bit.
They were both so worried about each other and they were the 2 with the worst injuries.
He's coming down next, okay? He's absolutely fine though. Right, I'll leave you guys to it. I think every ambulance in Edinburgh's here.
With the first pair safely on their way to the hospital, there are still 2 patients needing urgent care.
I think he has got a head injury, front, back, feeling dizzy, right rib pain, but good air entry, equal rise and fall. Okay.
The last remaining patient to come down is a young man who bore the brunt of the wall collapse.
Julie, all right? So we're taking him.
He was the one that was, the walls came down, he tried to catch it and then just crumpled in half underneath it and it's all gone down onto his back.
Jesus.
So he was in like a sort of fetal position when he came down.
Okay.
So he's complaining of quite bad lower back pain.
Central?
Yeah.
You alright, pal? Yeah? All this drama, eh? Okay. You sore at the moment?
It's just my rib and my lower back.
Okay.
Right, we good?
Yep.
The paramedics who are treating this patient hand over to Holly and Julie.
Had a sound in the chest. Lovely.
I'll have another quick wee listen just to check. Oh, thanks. Right, pal, I'm just going to have another wee listen to you, okay? Right, nice big deep breaths in and out.
With the rib injuries, we just need to be aware that, and just be very mindful that there's no injury to the actual lung itself, because obviously that can be an emergency if there is.
Where? The sides? Down here?
Yeah.
So we're just wanting to monitor him closely and just kind of keep him chatting and just keep him comfortable and keep him safe.
You've maybe got a wee bit of a fracture on it.
Yeah.
We'll get an x-ray.
Yeah.
So what is it you do? You joiner?
You know that.
Were you all joiners?
Oh, yes, we're joiners.
What are you building?
What? Flats.
Ah, of course. Central Edinburgh. Okay, I'm happy when you are. Cool.
Just 90 minutes after the wall collapsed, all 4 injured men are on their way to hospital.
Yep, hi there. I've got a trauma alert for a male at 11 a.m. this morning. A wall fell on top of the patient. He is complaining of lower back pain and rib pain. During those jobs, the adrenaline is definitely skyrocketing. You kind of present yourself very calm, but on the inside, your heart's beating 1,000 miles.
How are you feeling?
Aye, all right.
Just the same? Cool. Right. Lots more bumps, you okay?
Aye.
It was so helpful to have everybody there and everybody worked great as a team. And we managed to get everyone down safely.
Yep.
Sure.
Right, a few bumps, okay?
So we were lucky enough that we did have multi-agency teams come in and help us, and they were all amazing. Because as you can imagine, it's very difficult immobilising and getting 4 patients down, loads of scaffolding on rubble floor, and there was a lot going on.
Paramedic Shelby and ambulance technician Sophie are midway through their shift in air.
We've worked together since
bang on the week of Christmas we started together.
Yep, Christmas present. So that was us. What month are we in? 9 months.
9 months.
There you go. We actually do spend so much time together.
When you think about it, you do, yeah.
What's it like? We're just very chill.
Yeah, I think we are super laid back, to be fair.
When we started working, I said to Sophie, let's make a point of if she's having a bad day, tell me. So I think it's just honesty. It is like a relationship.
Yeah.
It is.
Ambulance emergency, is the patient breathing?
It's my husband, I think he's took a stroke.
Okay, I'm going to ask you some questions. Is he breathing?
He's breathing, aye.
Is he awake?
He's awake.
We are going to a 78-year-old male. Possible stroke. He's had a collapse in the chair. He's short of breath. Numb down one side. The symptoms kind of started this morning when he was trying to get off the bus. That's all they've given us just now.
It's been 4 hours since the patient took unwell. When it comes to suspected strokes, time is of the essence.
How long will we in for? An hour?
40 minutes. It'll be an hour when we get there.
Patients that are having stroke symptoms, if it's a certain type of stroke that it's a clot, there's treatment you can get within 4 hours at your nearest hospital that can reduce some or all of your stroke symptoms.
Hello.
It's my dad.
Jim, I just got briefly that you felt unwell in the bus this morning.
I was going out of town.
Right.
And it come on when I was sitting in the bus, I started to go numb.
So what can happen?
Tingling feeling down my arm and my leg.
Just your right arm?
Aye.
And my right leg. Okay. Are you had any pain or anything?
No, I've no pain.
Just the pins. Is it pins and needles type? Or is it...
I feel pins and needles. The first thing I thought was I was having a stroke.
Right, okay. Can you feel me touching your face?
Aye.
Can you feel both
I
sides?
could actually feel that, aye,
You
but
can
it's
feel
still a
that?
bit numb.
Just-
My lips is still a bit numb.
Is it more tingling?
Not tingling, no, it
Nummy.
just feels numb.
I was mainly thinking of a mini stroke or something along those lines, you know, like the pins and needles and the kind of symptoms he was showing.
Shelby carries out a FAST test, which stands for face, arm, speech and time. It's a series of tests designed to show if someone's had a stroke.
And can you give a big smile?
That's fine.
Aye. When I do that, I can feel my face going, kind of, I don't know, numb way, you know?
Okay. That's fine.
We're looking for lots of different things, but your obvious ones would be, have they got a facial droop? One side more drooped, like their face and their cheek. Have they got slurred speech or kind of talking kind of gibberish?
You can talk all right.
Oh, I can talk. So you get at that.
Everything looks okay. Your heart rate's a wee bit irregular. I'm not sure if that's normal for you or no normal. There's no obvious stroke, you've not got a weakness, like say when we were doing the tests and things, you don't have any weakness, you don't have anything like that, so I'm not worried about that.
After observing Jim through his FAST test, Shelby is not sure that a stroke is the problem.
Blood pressure's a wee bit low.
This is a wee test that we're going to have to get you today, and you need to be silent for it.
And still.
That's going to be hard for
That's
you.
gonna be hard for him.
That's going to be very hard.
Completely still.
So you need to stay still and no talking for 30 seconds.
Shelby monitors Jim's heart rate for any irregularities.
That's you can move now.
I'm not used to keeping my mouth shut.
No. Any other medical conditions that you suffer with?
No.
We're really kind of trying to figure out as much background as we could. We're kind of digging deep to try and figure out what was going on.
Blood pressure.
I'm on tablets there, they're
Right.
all lying there.
I'll get to
for
them.
bloods.
What have you been put on them for? Are you any heart
I've been on them
problems?
for years.
Okay.
No,
Just
I've
keep
got
that arm still, that's you.
on this arm and on my neck, blood vessel, no working.
Partially working, is it clot?
75%.
It just clicked straight away once he said
Yeah,
that.
as soon as he said
As soon as he said that, we're like, yeah, that makes more sense.
Jim has stenosis, a narrowing of the arteries which deliver blood from the heart to the brain.
If that's blocked, if you think about it, if it's only 75% blocked, it's obviously restricting the blood flow going up and down that side.
Stenosis, one of the most common signs and symptoms and side effects is the pins and needles and dizziness and lightheadedness, and they're very common, but he just had never had that before, so for us that was a sign that that artery has been getting a lot more narrow. It's really serious.
You're awfully quiet, Shani.
What do you call him? Papa?
Papa Jim.
Papa. Papa Jim's all right. Don't worry.
He's never been right. Isn't he? No, he's never been right.
He's just worried about you.
Stenosis can cause a stroke or symptoms of a stroke, which requires immediate treatment.
He's all good?
Yeah, thanks, Sophie, that's us.
Yeah.
I'm just checking
Well, a wee bit bumpy getting out of here.
A trip to University Hospital Cross House in Kilmarnock is needed.
Don't last this. What's it today?
Your birthday?
Aye, the day.
Oh, happy birthday! Did you not get her in for a birthday, Jim?
Jim doesn't believe in spending
Oh, you're
money.
cute. I was intended to get you something out of the tune, but when this come on, I couldn't get home quick enough.
It's a good idea. That's a good excuse, isn't it?
In hospital, Jim will receive further tests and medication.
Ambulance service, is patient breathing?
At the Ambulance Control Centre in southwest Glasgow, call handlers receive around 310,000 emergency calls every year.
What's the address of the emergency, please?
The information they gather helps determine where paramedic resources are sent. Calls can be routed to them from any part of Scotland.
What town or city is it in, please?
Today, Lauren's taking a call from a woman who's found an unconscious man on Edinburgh's Princess Street.
Okay, can you have a wee check for me and see if he's breathing? Yeah, he's breathing.
When we receive a call from a patient that's reported unconscious,
And is his breathing completely normal?
it's a lot higher risk than when a patient just isn't responding.
Bit stuttery. Okay, and is he still unconscious at the moment? Okay. So I'm organising help for you just now.
We keep a very, very close eye on their breathing because at any point something could change with their breathing and that could be a life or death situation.
Okay, so we're going to check his breathing together to make sure that it's all right. When I say go, watch him very closely and tell me each time that you see his chest rise. Do you understand? No problem. So are you ready? Go. And again. And again. And again. And again. Perfect. Yeah, that's perfect. Okay, so I'm organising help for you just now. Stay on the line and I'll tell you exactly what to do next.
Clinicians have crafted a series of questions for handlers to ask to give patients the best care while they wait for paramedics.
So listen carefully, lay him flat on his back and remove anything from under his head. Place your hand on his forehead and your other hand under his neck and then tilt his head back. If he vomits, turn him on his side and clean out his mouth and nose. I'll stay on the line with you until help arrives. Tell me when the ambulance crew is right with him or if anything changes. So just keep checking his breathing and make sure nothing changes with it.
It helps reassure that the caller that it's not just on their shoulders and that they don't need to deal with everything themselves, that they do have that support from us coming to help them. It just makes them feel a lot better and more relaxed so that they can give us more information to make sure that we can help as much as we can.
That's no worries. So if you just keep a close eye on him, I'll let you know when the ambulance crew is getting closer. Right, just confirm if they're still unconscious at the moment. That's no problem. Just keep a close eye on it.
The woman's growing increasingly anxious.
can assure you that they are coming to you as quickly as possible.
It can be a lot nicer when they feel as though it's a friend on the other side of the phone than someone just a robot on the other side of the phone, if that makes sense.
So you're doing really, really well. No problem. Just let me know when they're right there with you. It does look as though an ambulance crew should just be beginning to arrive just now. If possible, if you could flag down the ambulance, so if you could just wave them down, just so they're able to spot you. Yeah, no worries. I'll leave you with the ambulance crew. You've done really, really well. Thank you. Take care. Bye-bye.
From the moment the caller dialed 999 to the paramedics arriving on scene took less than 10 minutes. Linwood, a small town 10 miles to the west of Glasgow and home to one of Scotland's Special Operations Response Teams, a group of highly trained paramedics who attend the most challenging calls. SORT team leader Daniel and paramedic Nicole have been dispatched to an ongoing incident 30 miles away.
Receiving, go ahead.
On scene at this fire in Airdrie. Just to confirm, it's a disused care home. It's not an active care home, over.
Although the property is derelict, eyewitnesses have reported seeing youths in the building minutes before the fire was spotted.
The fire brigade can't confirm if all the youths have been accounted for.
You do have 2 SORT resources comprising of 3 paramedics heading to your location with the option of a further 2.
Yeah, that's a roger. The fire is well ablaze. 2 separate fires and a short station over.
All received, thank you.
The biggest concern for the emergency services is that some of the youths may be trapped inside the building.
They've now got 7 fire appliances, which is quite a high level response from Scottish Fire and Rescue. A mile to go. That's pretty smoky.
Well, we're just putting the river I go in here.
Yeah, we'll get some FFP3s.
We're just changing in about, alright?
So currently there's a fire in the outhouse building directly in front of you, which looks to have destroyed the roof. The initial fire in the larger of the 2 properties was put out, but it now seems that the heat is likely to reignite. You can see from the water going onto the roof that it's producing quite a lot of smoke.
As far as I'm aware, it started off in one area and then it's transferred over and it's just spreading having a pun, like wildfire. It's just progressing further and further into the building, and because there's no escape for it, it's just getting worse and worse. There is currently a multi-agency meeting going on with Dan and Karen to find out what our next steps are to do with the police, the fire service and ourselves.
We do have a witness who has seen a small fire at this point and then kids in and about that pitched roof just behind the sign, hence why the fire brigade are starting to put all their emphasis onto that side. Youths were actually on top of this roof. My concern only is the nature of them on the roof. I feel it's justified to keep an ambulance here in case suddenly they come across a youth who's going to need it.
SORT team leader, go ahead, you're ready, over.
Type of incident, we have a fire in a derelict care home consisting of 2 large buildings. Number of casualties at present is 0, but we have not confirmed that all the youths in and around this property are accounted for.
SORT team leader, that's all received. Thanks so much for the update, over.
Hope being that they've realised what they've done and they're hiding somewhere rather than in the property. My hope is they would have got out once it started.
.999 mode activated.
Go to Gala then, Marky boy.
So we're off to an 88-year-old female with breathing difficulties.
Back in Melrose, paramedic Lee and ambulance technician Mark have been tasked to a red call, meaning there's an immediate threat to life, at an address in Galashiels, 3.5 miles from the station.
Okay, there's not a lot of information coming through yet, but she's basically coded generally unwell. She does have some breathing difficulties, but she's equally struggling with a sore and swollen left leg.
So potential for a DVT then?
Could be a DVT, yeah.
DVT, or deep vein thrombosis, is a potentially life-threatening condition where a blood clot develops in a patient's leg.
The blood vessels in your legs around your calf muscle are quite large. So when that clot, that thrombus, potentially fires off from your calf, it'll travel up those big blood vessels to your heart, pass through your heart, and then pass into much more thinner blood vessels like in your lungs, which would be a pulmonary embolism, which is a potential life-threatening condition. The other thing that could happen is it could fire up in your brain and cause a stroke.
Looks like it might be in those flats.
Well, you could be right there.
Yeah, I think we're in there. Yeah, that's exactly where we're at. Okay, see what we've got.
Hello.
Hi.
Hello. Hello, my name's Mark and this is Lee. So, Sheena, can you tell me a bit about what's been happening today?
Well, this has happened yesterday. It's got worse today.
Okay.
It's pain.
And it's sore, so you feel that's quite swollen?
Yes.
It's quite hot
Yes.
to touch,
Yes.
isn't it?
Yes.
Can I have a look at your other leg as well, just for a wee comparison? Okay.
Sheena is in her 80s and lives alone. She's visited by carers who keep a record of any health changes.
It's actually the carer who called for her.
The care's actually done a really good job documenting things as well of the previous day, so we could look at our care plan and our diary and look at how things have changed. Carers in the community do an amazing job. They have a significantly challenging job. The service they offer to our elderly population is amazing. What they do and the care they provide, what I've seen firsthand, is exceptional.
Feel as if that's generally getting
Gradually got worse.
worse. And is that
'Cause
something?
I didn't think it needed anything, and it's got further up my leg as well.
Okay. So, is it sore to touch?
No, not there.
Okay. Anything in here?
Not there, no.
Sheena, this is going to get tight in your arm just for
Yeah.
a second, okay?
Okay.
We need to be careful with infections and we need to look at how they're presenting.
How do you feel, general? Do you feel unwell?
I didn't feel very great, no.
No. Infections can come in all various forms in terms of different, whether it's bacterial or viral infections, etc. And that really needs blood tests from the hospital to identify what they are to give the right treatment. And have you got any sign of any kind of chest infection or any
No.
coughs or anything new?
No, just my usual reason is...
But just with your asthma. And since you've spoken to us, is your breathing settled a little bit? Are you quite
Yeah.
happy that it's come down a little bit?
Yes,
Good.
I just get excited.
Okay. Well, you get two handsome medics in here, so you're bound to get a bit excited.
Right.
Okay.
Well, that's going okay, yeah.
Yeah, Sheena, you've got a wee bit of a temperature. It's at 38.3, which is not. It's a wee bit above normal, but it would indicate you've maybe got a wee bit of an infection going on.
But she's got quite a lot, like,
My foot's
edema.
getting-
I wonder
my
if it's
foot's
maybe
sore
lymph,
as well.
lymphedema, lymph
Under
nodes,
my
or-
foot sore.
Under your foot
Under
sore?
my heel.
Okay, under your heel.
Edema is a buildup of fluid, and Sheena has it around her foot. The combination of being hot to the touch and the edema lead Lee and Mark to a potential diagnosis.
You feel warm to touch?
Yeah,
but
definitely,
more so on
yeah.
that side.
So kind of
Agreed.
wonder if it's cells, maybe cellulitis or something.
You just took the words out of my
Maybe
mouth,
it's to do
so.
something with...
But normally it's a bit more red and shiny than that.
Cellulitis is basically a skin condition, a skin infection. Quite often with cellulitis, you'll see like a redness or an infection developing. Now, I couldn't see that, but it did feel quite hot to touch.
The good news is that cellulitis can be treated with antibiotics. But Sheena's other symptoms are still a cause for concern.
My thought is to pop you down to the BGH just to get you checked out. Are you okay with that? You quite happy? There is another possibility as well, which you may well have a deep vein thrombosis as well. Take your cane.
So if you grab that bar just...
So regardless of what we think it could be, our best advice with Sheena is to advise her to go to hospital. Perfect, up you come. Gotcha.
Right.
The way the population's changed over the last few years, there is a bigger elderly population. Are you quite comfy? Okay.
Chilly though.
Yeah, we're going to close that door in a second then. That they want to stay at home for as long as possible. They want to look after themselves as long as possible, and quite rightly so.
She is a difficult patient for us to leave at home. All the answers are in Sheena's blood. They'll advise the doctors of what course of treatment is best for Sheena at this moment.
plan at the moment is going to be at least another hour until the next multi-agency meeting. Fire brigade and police at that time should have a better idea regarding the location of the youths who potentially may have started the fire.
SORT team leader Daniel is on scene at a massive fire that has ripped through a disused care home. As firefighters battle to get the blaze under control, 3 teenagers are still unaccounted for.
At the moment, due to the fact that they were seen on the roof, there's still a concern that they may be in and around the property and may need treatment. At the moment, it really is just a waiting game and assisting the fire service in their attempts to get the fire under control.
The fire is spreading so fiercely that firefighters are unable to get inside to search for the youths.
This roof is going to be ablaze for hours.
But police officers have managed to track down the witness who first reported the fire.
She was literally driving by. She went across there to try and extinguish it with a bottle of water, and when the fire started to take hold a wee bit, that's when she's made off and she's seen the youth.
While police continue their search for the youths, the fire service have another big problem on their hands.
They've got water table issues, so they're trying to run 4 hydrants at the moment. They're running the water from the 4 tenders down there, so water pressure's a slight issue. The fire service are effectively given up on the outbuilding directly up the drive because it's effectively burnt itself out as best it can.
As the fire service battle the blaze, Daniel has to deliver a status report back to base.
I'm hoping the police are going to come back and tell us that they've got confirmation that those involved have been seen travelling up the road, and they can confirm that. There's someone who's been trapped in that roof for that long. They're unfortunately deceased.
Finally, the crew receive a positive update from police, who have been conducting inquiries.
So the working strategies now is that we don't think there's anybody in that building.
No, we don't think there's anybody in there.
We don't think. We think that the same people that were on that roof are made off.
So we've been told that the youths involved have been located and their whereabouts is known. That's a massive relief, not only for their safety, but it completely changes the dynamic of this job and takes away the potential need for medical treatment from us, and more importantly, the need for firefighters to enter this property for any reason. So that's a massive relief all round. We'll obviously keep a minimum of 2 paramedics here.
Daniel will keep a skeleton crew on scene until fire crews have the blaze under control.
What we did now internal firefighting,
sure.
For us it's still external, it's now heat, not hot, so...
If 2 SORT paramedics here are appropriate for you, I think that gives you a bit of extra resilience safety-wise, and just in case someone does appear from a field with smoke inhalations, it means you can just pass them off to someone else. There's no further requirement for this number of ambulance resources, so we'll scale back our response.
So what is it we're going to?
2-year-old Lottie, she's been brought into Air Hospital by her mum. She's having multiple seizures, so she's going up to Crosshouse Kids.
Paramedic Shelby and ambulance technician Sophie have been tasked to a patient transfer, taking toddler Lottie from University Hospital Air to paediatric specialists at Kilmarnock's Crosshouse Hospital. Paramedics are sometimes called upon to move patients to hospitals that can offer more specialized care.
Has she ever had seizures before?
With a temperature of 39.5, hospital staff have administered paracetamol and ibuprofen to try to bring down Lottie's temperature.
I know. Right. That's us. It's hard.
Yeah, it is. It's different with children than adults. You know, they can't tell us exactly how they're feeling. Yeah, there is just something about kids. It's always going to be slightly harder dealing with kids than adults.
So how has she been the last few days? Kind of clingier, unusual. Okay.
The children can't communicate and tell you what they've been like, so you really, really need the parents to tell us really how that child is, how they've been. You're also trying to reassure the parent, again, if they see us panicking, they're going to panic. So you need to try and be as calm as you possibly can.
It's hard to tell because Monty is struggling with a couple of things now, so it's hard to tell the difference what's normal for lots and what's not normal.
It's just to piece together what's happened, you know, the events leading up to it, you know, how were they the day before, how were they this morning, how have they been, have they noticed any changes, have they been eating normally, drinking normally, you know, it's just trying to piece together what's actually caused the event that's happened.
Our balance has been really bad this week.
All right.
She's got quite a few bruises from head. She's a little stumbling or just her legs.
Oh.
Which is tired more.
Yep.
See her kind of swaying. And yesterday, okay? Yesterday shouldn't be falling. Okay.
And was the other one when it was in the house when you brought it, was that like a full seizure? Was that like...
She was like...
Yeah, proper seizure. And how long did it last for?
If the seizures last longer than 15 minutes, they are known as complex febrile seizures and are much more serious. So Shelby keeps a close eye on Lottie's temperature.
So temperature's coming down still, because when she first went into the department it was 39.5, so it's down to 38.5. You don't really want to cool them down really, really quickly. You don't want to start putting cold flannels and cold bags of peas and things. Some people try and do that to cool them down, but that's more dangerous, bringing your temperature down too quickly, so you want to make sure it's just coming down gradual.
It's good that she's got a temperature because we know that there's something, there is a reason, and that's like, as much as it's not nice, it kind of is good because we know there's something wrong. They'll maybe just need to find out why she's got a temperature and fix that, and then hopefully everything should be all right. Yeah. Our heart rates came down a good bit as well. I know it was a wee bit up at the hospital, so it's came down and our temperatures came down, so. So here, Sophie will go in to the paediatric department and see where we have to go, and then we can take her in. Temperature's down to 36.9. She's got a bit really well. That's what I thought. She's been the wee star. Right, you no crying now that we're going to wake you up.
We bump
We love to hear babies cry. We absolutely love it. Babies are okay if they're crying.
It does sound bad, doesn't it? But it's, yeah, like you say, it's always, yeah, it's a good sign.
It could be that an ear infection has caused the fever and trouble with Lottie's balance, but it'll be down to the paediatric team to find out for sure.
Getting rattled about.
It's early afternoon, and in Scotland's capital, paramedic Holly and student technician Julie are heading to a job in the north of the city.
So, Holly, we are going to a 76-year-old female. She's conscious breathing, she's got abdominal pain, there's a query bowel obstruction, about 4 minutes away.
Okay, cool. So, query bowel obstruction?
Yeah.
A bowel obstruction is like basically just as it sounds, it's a blockage in a part of the bowel. But if the blockage is there too long, it can stop kind of blood flow going to other parts of the bowel, which means it's not getting oxygen. They can be quite serious, and in worst case scenarios, you know, they can cause part of the bowel to essentially die off because it's just not getting the oxygen it needs.
They're heading to an address in an affluent part of the city, but their sat-nav is giving them the runaround.
I think it was in there.
Oh yeah, wait, was that the there?
What number's that?
In Barad. Some gorgeous houses around here.
Oh god.
Imagine living in one of these. Imagine the heating bills though.
I remember my mum used to be a cleaner. She used to clean the house up there. And I used to go, like, if I was on holiday from school or whatever, and I remember their garden was, it was like a field. I'd just be out playing in the garden for ages.
You want me to take that?
If you like.
Thank you, Tinkle.
Oh.
Hello. Ambulance. What's happened to you, Jane?
Okay, we're 3 days with no food and no medicines.
Okay.
I've been able to sip water, but if I try to take a pill with it, it comes down. Pain in my guts has been 3 solid days. Now, usually it starts with the feeling that you need to go.
You need to be able to have a conversation with people. You need to be able to ask awkward questions. Because at the end of the day, no one wants to be talking about their bowel habits with you, but you know, you do.
Now, usually I wake up at 5 with the pain. Chills, which is I don't usually get, and I've got the hottie on my belly day and night for the pain. And I was on cocodamol, but trying to keep anything down isn't working.
No. Cocodamol's not very good for it. Can cause constipation and stuff. So
I know my pharmacology. I'm clinical psych. Addiction, mental health, and trauma.
Oh, wow.
So I was all over Europe. Oh, I'm talking too much.
Okay, you feeling dizzy?
Yes.
Okay, can I have a wee feel of your wrist?
Sedation, but I'm trying to keep some water down. Yeah. And, I can't talk anymore.
That's all right. Just take a breath.
I'm scared.
Oh, sorry, don't be scared. I understand you're scared. No one likes going to the hospital, but it sounds like you're maybe just a bit backed up, or it might be a bit of like an obstruction or something, and these are easily fixed.
But to now have my brains go.
In what way?
Dementia.
Do they know what type of dementia?
Vascular.
Okay. There's different types of dementia, and this one is caused by reduced blood flow in the brain. And it's extremely difficult and distressing for the patient suffering with it and for the family members and friends around them, because quite often in severe cases, you know, you can have a complete change of personality and you might forget your family members and friends that you've known all your life.
Well, take my arms and legs, but all I have left is my brains.
How long have you been in Scotland, did you say?
I've been here since 1970, married Aletha for me sins, and I can't get rid of my Big Apple accent.
I was gonna say, you're a New Yorker.
I burnt my bra in 68 in New York, protesting for the Vietnam War. We were going to change the world. We were so sure we were going to change the world.
Got some life you've led, eh?
I was a bad girl.
A bad girl.
But you loved it, you can tell.
The best way to be, eh? She's a fascinating woman with an amazing life story. So it's obviously upsetting for her, and she wants to talk to us about these stories.
I haven't got an O level to my name, and I got left back in high school because of being a trauma kid. I was a crazy teenager. I came from a very dysfunctional family, a lot of violence. I got away at 19, and I never went back.
Yeah, I can imagine why you never...
But then I went to clinical psych at Berkeley, and that was great, and then they chipped in and gave me fares to London.
Since turning her own life around, the patient Jane tells the crew she's helped young people in some of Edinburgh's most deprived areas.
When I first got here, I went into a rehab, and I come back at night, and I said to my husband, I can't work here. They're talking about Beddens and Waynes and Simmets, and it's awfully
That's a very Scottish word.
It's very Scottish.
And I couldn't. I said, he doesn't talk. He just talked normal. He didn't have the strong.
Yeah.
I got on fine with the kids. I understood them. They understood me. Because I'm a street kid.
Probably the biggest part of the job is
Yeah.
speaking to people, just having conversations, whether it's good or bad.
Oh, we're just open ears essentially, and sometimes that just really helps the patient.
Grab a wee seat. Loneliness is a huge issue actually, and it can affect anyone at any age, but it often affects the elderly population. Some of them have obviously lost their families, lost their friends, and it's awful. How are you feeling now that you've kind of stood up and moved?
A bit shaky.
A bit shaky, okay. I've had quite a few times where I've been called out for an emergency for whatever reason, and actually the issue is that the patient's lonely and just needs someone to talk to.
Cool. Holly's going to go get us a chair and then we'll go in.
At the Western General Hospital, Jane will have scans taken of her intestines to find out the cause of her bowel obstruction. For Holly and Julie, it's been a memorable encounter.
There we go, come grab a wee seat then. Some people, you learn a lot from patients. Some people have just fascinating stories and fascinating lives. Yeah, it's probably one of the best parts of the job, I would say, is getting to meet these people. Right, and we'll get you booked in.